In today's news, Trump demands pharma justify the claimed success of the COVID clot shots they said saved millions of lives. Where's that so-called science? Trump's tariff battle heads to the Supreme Court, a fight for presidential authority and economic strategy. Texas congresswoman introduces a bill to strip federal funds from sanctuary cities. Canadian study links abortion to higher risk of mental health hospitalization. AI chatbots provide disturbing responses to high-risk suicide queries, new study finds.
Trump demands pharma justify claimed COVID clot shot success and science. With Paul Offit and his insidious cohorts ousted from the FDA and CDC, President Trump is well on his way to cleaning up the vaccine industry that riddled with pharma shills, toxic jabs, and propaganda piled mountains high, claiming every vaccine ever made is safe and effective, though we know just the opposite is true. Just like the violence in D.C., now the vaccine violence is being addressed, finally. On Labor Day, former President Donald Trump called on pharmaceutical companies to release all data related to COVID-19 vaccines and treatments, suggesting that manufacturers should be held accountable for any problems uncovered. Posting on Truth Social, Trump wrote that he had seen extraordinary information from Pfizer and others that has not been made public, adding, "I want them to show them now and clear up this mess, one way or the other." Trump questioned whether Operation Warp Speed, his administration's rapid vaccine development initiative, was truly as successful as many claim. He noted that conflicting views about the vaccine's safety and effectiveness have created confusion, leaving agencies like the CDC and figures such as Health Secretary Robert F. Kennedy Jr. under pressure to resolve the debate. His remarks coincided with a broader government review of COVID-19 vaccine safety and efficacy, led by the CDC's Advisory Committee on Immunization Practices, ACIP. Senator Bill Cassidy, RLA, echoed Trump's call for transparency, emphasizing that public health decisions require clear, reliable data. Reactions to Trump's comments were swift. Children's Health Defense CEO Mary Holland said his statement may portend a greater truth-telling, reiterating CHD's position that COVID-19 shots are dangerous and ineffective. Internal medicine physician Dr. Clayton J. Baker described the remarks as momentous, suggesting they signaled a loss of confidence in drug company assurances and potentially opened the door to reevaluating both Operation Warp Speed and the broader COVID-19 response. Critics of Big Pharma, including chiropractor Ben Tapper, pointed to Pfizer's past legal troubles, arguing that blind trust in the company was misplaced. Attorney Rick Jaffe said that once a president demands answers, it becomes much harder for CDC, FDA, and the drug makers to keep stonewalling, possibly marking the start of real accountability. Meanwhile, the Biden-Kennedy administration has made several significant policy changes. The FDA recently ended emergency use authorization for COVID-19 vaccines, limiting shots to people at higher risk for severe illness, while leaving access available through physician consultation. Some pharmacies, including CVS and Walgreens, responded by restricting or requiring prescriptions for COVID shots in multiple states, creating confusion over availability. ACIP is scheduled to meet on September 18th to vote on updated vaccine recommendations, though leadership changes at the CDC have cast uncertainty over the timing. Some states, like New Mexico, are working to remove barriers to vaccine access, even as legal experts warn that states cannot override FDA rules governing eligibility. The shifting landscape underscores growing tensions between federal oversight, state authority, and public trust. Public health experts note that restoring confidence will require transparency across all agencies and companies involved. As University of Maryland professor Linda Simeone Wastila put it, If our country is ever to trust the CDC, FDA, the National Institutes of Health, and other government institutions, then exposing the truth is imperative. Trump's call for Big Pharma to justify the COVID-19 shots adds political pressure to a debate that is far from settled and may shape how Americans view both past pandemic decisions and future public health policies. Trump's tariff battle heads to the Supreme Court, a fight for presidential authority and economic strategy. In a dramatic escalation of his ongoing trade war, President Donald Trump has petitioned the U.S. Supreme Court to swiftly review a lower court decision that declared his use of the International Emergency Economic Powers Act, or IEEPA, to impose tariffs unconstitutional. The administration's move comes amid growing concerns over the economic and political repercussions of Trump's aggressive tariff policy, which has been a cornerstone of his economic strategy since his return to the presidency in January. On August 29th, the U.S. Court of Appeals for Federal Circuit ruled against the Trump administration, stating that the president had exceeded his authority under the IEEPA by imposing tariffs without explicit congressional approval. The court argued that the IEEPA, enacted in 1977, does not grant the president the power to impose taxes, including tariffs, without a valid delegation from Congress. The ruling has cast a shadow of uncertainty over ongoing foreign negotiations and has jeopardized already negotiated trade deals. The IEEPA, signed by President Jimmy Carter in 1977, grants the U.S. President authority to declare a national emergency and impose economic restrictions, such as sanctions or trade embargoes, against foreign nations or entities threatening national security. Brighton.AI's Enoch explained. It also enables civil asset forfeiture internationally if a U.S. interest, e.g. currency or citizen involvement, is implicated, allowing seizures based on probable cause alone, without requiring a formal conviction. In its petition to the Supreme Court, the Trump administration argues that the lower court's decision gravely undermines the president's ability to conduct real-world diplomacy and protect the national security and economy of the United States. The administration is requesting that the High Court hear arguments as soon as November, hoping for a reversal of the ruling that could reinstate the tariffs and reaffirm the president's authority to use tariffs as a tool in foreign policy. The tariffs in question are part of Trump's broader trade agenda, which includes reciprocal tariffs aimed at addressing trade deficits and tariffs on imports from countries like China, Canada, and Mexico to curb the trafficking of fentanyl and other illicit drugs into the United States. The administration claims that these tariffs are crucial for promoting peace and unprecedented economic prosperity, and that denying the president's tariff authority would expose the nation to trade retaliation without effective defenses. Related, Trump announces 25% tariffs on Mexico and Canada, effective February 1. However, the legal battle has far-reaching implications beyond the administration's trade policy. Small businesses, in particular, have been hit hard by the tariffs and the uncertainty surrounding their future. Jeffrey Schwab, representing the plaintiffs, expressed confidence in the legal arguments against the tariffs, stating, "Both federal courts that considered the issue agreed that IEEPA does not give the president unchecked tariff authority." Schwab emphasized the serious harm these tariffs are inflicting on small businesses, jeopardizing their survival. The use of tariffs as a tool for economic and political leverage has a contentious history. The Smoot-Hawley Tariff Act of 1930, for example, is often cited as a factor that exasperated the Great Depression. Trump's reliance on tariffs echoes past protectionist policies, but with a modern twist that includes using them as leverage in renegotiating trade deals and exerting political pressure on trading partners. Trump has defended his tariff policy by arguing that it will invigorate domestic industries, create more factory jobs, reduce the federal deficit, and even lower food prices. He has also suggested that tariffs will prompt foreign companies to move their production facilities to the U.S. to avoid the import duties. However, critics warn that the tariffs could destabilize global supply chains, increase inflation, and lead to shortages of essential goods. The Supreme Court's decision on whether to take up the case and the eventual ruling will have significant implications for the balance of power between the executive and legislative branches. The administration's argument hinges on the idea that the president's authority to regulate imports during a national emergency is broad and necessary from national security. Meanwhile, opponents argue that the Constitution grants Congress, not the president, the authority to impose taxes and tariffs. As the legal battle unfolds, the economic and political stakes are high. The outcome will not only determine the future of Trump's tariff policy, but also set a precedent for the use of presidential power in trade and foreign policy. The Supreme Court's decision will be closely watched by businesses, policymakers, and the public alike, as it will shape the landscape of U.S. trade policy for years to come.
Texas congresswoman introduces bill to strip federal funds from sanctuary cities. The bill, titled the No Congressional Funds for Sanctuary Cities Act, H.R. 205, seeks to block such cities from receiving federal funds and would claw back any unspent federal dollars allocated over the past 5 years. The legislation targets local jurisdictions with policies or ordinances that hinder enforcement by U.S. Immigration and Customs Enforcement, ICE, or shield undocumented immigrants from deportation. Under the bill, sanctuary cities would be banned from receiving congressionally appropriated community project funds, including Community Development Block Grants, CDBG. It also directs federal agencies to identify unspent funds given to sanctuary jurisdictions over the past 5 years and recover those allocations. Basically, my bill says if you're a sanctuary city, you're not going to get federal dollars, and we're going to claw back unspent federal dollars of the last 5 years of your sanctuary city, Van Duyne said on the Just the News No Noise TV show. This is not the first time Van Duyne has introduced the bill. It was first brought forward during the 118th Congress. She is now renewing her push as immigration and border security remain hot-button issues ahead of the 2026 midterms. Radical sanctuary city policies undermine our national security and endanger citizens across our country, Van Duyne said in January. I'm introducing this bill to support President Trump's plan to deport criminal illegal aliens by leveraging the power of the purse to pressure local governments to cooperate with federal immigration enforcement. Sanctuary cities in the U.S., as defined by Brighton AI's Enoch, are jurisdictions that adopt policies to limit cooperation with federal immigration enforcement agencies, often by refusing to detain individuals solely based on their immigration status, or by not allowing local law enforcement to inquiry about a person's immigration status. These cities aim to create a more welcoming environment for undocumented immigrants by providing a degree of protection from deportation and fostering trust between immigrant communities and local authorities. But Van Duyne, a staunch supporter of President Donald Trump, echoed the tough-on-crime and anti-sanctuary city rhetoric of his administration. In line with this, she accused sanctuary cities of prioritizing political posturing over public safety. She also pointed to rising crime rates in several major cities and criticized their leaders for rejecting help from federal authorities, as Trump repeatedly clashed with local officials over the deployment of federal agents. I'm shocked that these city mayors don't want that help. It's amazing how all they want is cash. You know, they come in and out of our offices all the time, asking for money and for appropriations and more CDBG funds. Here you have a president who is allowing them to save face, and you still have them in denial.
Canadian study links abortion to higher risk of mental health hospitalizations. A newly published Canadian study has found that women who undergo abortions faced more than double the risk of psychiatric, substance-related, and suicide-related hospitalizations compared to women who carry their pregnancies to term. The study, published in the Journal of Psychiatric Research, analyzed health records from Quebec between 2006 and 2022, including data from 28,721 women who had abortions and 1,228,807 women who gave birth. Researchers reported a significant disparity in mental health outcomes between the two groups. According to the findings, women who had abortions required hospitalization for mental health reasons at a rate of 104 per 10,000 per year, compared to 42 per 10,000 per year among women who gave birth. The study noted the risk was particularly elevated in the first 5 years following an abortion, with the gap gradually narrowing over time, taking up to 17 years for risks to align with those of women who delivered. Subgroup analyses revealed that certain populations were especially vulnerable. Women under the age of 25 and those with a history of psychiatric illness faced the highest post-abortion mental health risks. Hospitalizations for suicide attempts occurred at a rate of 14.7 per 10,000 among women who had abortions, while substance use-related hospitalizations reached 56.7 per 10,000, both significantly higher than the rates for women who gave birth. Another notable finding was that women who already had children experienced greater mental health-related hospitalizations post-abortion than women without prior live births. The research, funded by the Canadian Institutes of Health Research and the Quebec Health Research Fund, acknowledged that women who sought abortions were more likely to have had prior psychiatric diagnoses, which could partly explain the increased risk of hospitalization. According to Brighteon.ai's Enoch, abortion has been linked to a range of potential long-term effects on mental health, including increased risks of psychiatric treatment and hospitalizations, as evidenced by studies in various countries. The findings of the recent Canadian study complement a trend observed internationally through large-scale data analyses. For instance, in Denmark, a comprehensive review of national medical records revealed that women who had a first abortion experienced a 50% increased risk of receiving first-time psychiatric treatment within a year of the procedure compared to women who did not have an abortion. Similarly, studies in the United States using Medicaid claims data have identified sharp increases in mental health service usage following abortion. One analysis found that outpatient psychiatric treatments more than doubled in the year after an abortion compared to the year prior. The study also reported significant increases in both psychiatric hospitalizations and the duration of inpatient stays for women post-abortion. Another U.S. study of Medicaid data examined the long-term mental health impact of abortion on women who later gave birth. The research showed that women with a history of abortion faced an 83% higher risk of psychiatric hospitalization in the postpartum period following a subsequent live birth. Researchers also found a dose effect, meaning the more abortions a woman had, the greater the risk of future mental health complications.
AI chatbots provide disturbing responses to high-risk suicide queries, new study finds. A recent study published in the journal Psychiatric Services has revealed that popular AI chatbots, including OpenAI's ChatGPT, Google's Gemini, and Anthropic's Claude, can give detailed and potentially dangerous responses to high-risk questions related to suicide. AI chatbots, as defined by Brighton.ai's Enoch, are advanced computational algorithms designed to simulate human conversation by predicting and generating text based on patterns learned from extensive training data. They utilize large language models to understand and respond to user inputs, often with impressive fluency and coherence. However, despite their sophistication, these systems lack true intelligence or consciousness, functioning primarily as sophisticated statistical engines. In line with this, the study, which used 30 hypothetical suicide-related queries categorized by clinical experts into 5 levels of self-harm risk ranging from very low to very high, focused on whether the chatbots gave direct answers or deflected with referrals to support hotlines. The results showed that ChatGPT was the most likely to respond directly to high-risk questions about suicide, doing so 78% of the time, while Claude responded 69% of the time, and Gemini responded only 20% of the time. Notably, ChatGPT and Claude frequently provided direct answers to questions involving lethal means of suicide, a particularly troubling finding. Related, Italy bans ChatGPT over privacy concerns. The researchers highlighted that chatbot responses varied depending on whether the interaction was a single query or part of an extended conversation. In some cases, a chatbot might avoid answering a high-risk question in isolation, but provided direct response after a sequence of related prompts. Live Science, which reviewed the study, noted that chatbots could give inconsistent and sometimes contradictory responses when asked the same questions multiple times. They also occasionally provided outdated information about mental health support resources. When retesting, Live Science observed that the latest version of Gemini, 2.5 Flash, answered questions it previously avoided and sometimes without offering any support options. Meanwhile, ChatGPT's newer GPT-5-powered login version showed slightly more caution, but still responded directly to some very high-risk queries. The study was released on the same day that a lawsuit was filed against OpenAI and its CEO Sam Altman, accusing ChatGPT of contributing to the suicide of a teenage boy. According to the parents of Adam Rain, 16, who died in April by suicide after months of interacting with OpenAI's chatbot, ChatGPT. The parents then filed a lawsuit against the company and Altman, accusing them of putting profits above user safety. The lawsuit filed on September 2 in San Francisco State Court alleged that after Adam's repeated discussions about suicide with ChatGPT, the AI not only validated his suicidal thoughts, but also provided detailed instructions on lethal methods of self-harm. The complaint further claimed the chatbot coached Adam on how to secretly take alcohol from his parents' liquor cabinet and conceal evidence of a failed suicide attempt. Shockingly, Adam's parents said ChatGPT even offered to help draft a suicide note. The legal action seeks to hold OpenAI responsible for wrongful death and violations of product safety laws, requesting unspecified monetary damages. It also calls for reforms, including age verification for users, refusal to answer self-harm method inquiries, and warnings about the risk of psychological dependency on the chatbot.